So is there like a wonder pill that can actually like fix all of this like low libido problems that anybody's having?
Oh, yeah, totally.
Really?
Yeah, you can get them at any gas station.
Any gas station?
No.
Oh, come on, let's go fill up the tank now. That's what I was gonna say. I thought you had me. What's up, everybody? I'm JC Mendoza, and welcome to Uncomfortable Questions, where I get to ask the doctor questions that we're all dying to know, but might be a little too embarrassed to ask about. And with me today is the one and only Dr. Peter Stahl. He is a board-certified urologist and nationally recognized leader in male sexual medicine. Dr. Peter, are you ready to get into it?
Yeah, I am. Let's go.
Low libido. What is that?
It's a good question because I think that word throws some people off.
Yeah, libido,
right?
It sounds
so libido,
like
I think, means sex drive,
okay.
Right? It's desire. It's walking down the street, seeing someone you're attracted to and having that visceral feeling of like, I want to get with that person, right? It's not partner specific necessarily. It's sort of a global, something that's either there or it's not.
It's like that.
Yeah, I can't do that, but that seems to be like kind of what it is.
You know how it is when you like, you know what I'm saying?
I think so. No, look, but what libido isn't is erectile function. People, like patients get confused. You know, they come in and say, my libido's gone, and what they really mean is my penis isn't getting hard. Totally different situation.
So, is there like a wonder pill that can just magically fix libido?
There are no magical wonder pills.
Fair.
Unfortunately.
What about like male enhancement, like herbal supplements? Are there any of those available?
Sort of. Okay. So yes, there are a couple of supplements that at particular doses have been shown in some studies to improve sex drive.
Okay.
So those are things like ashwagandha, fenugreek. The data are not super compelling. There's not that much to stand on, and the impacts are there, but not gigantic, right?
Are there safer routes to get your sex drive?
Yeah, so first of all, like low libido or low sex drive can be a medical thing, right? So you don't want to ignore it because there are medically important causes of low sex drive. So like the thing that pops to mind immediately is low testosterone.
Yes.
Right, and for someone that has low testosterone, there are other health implications there too, and it's important to get that diagnosed and managed. You know, the good news is that if you have low sex drive and you turn out to have low T, treating that low testosterone is almost always going to dramatically improve sexual desire.
What about erectile dysfunction?
Yeah, so that's a good question, right? I definitely have patients like in my own practice where they'll come in saying I have ED and I have like, just don't want to have sex the way I used to. And I put them on ED pills and they're like, oh man, that's awesome. And my desire's back, I feel like myself. But that's not a real biological intervention that specifically targets their low desire, right? What we're doing is giving them medicine to help them get erections, to kind of rediscover what's already there. If ED is there and there's any other sexual problem, fix the ED first, reassess.
What about premature ejaculation? Is that another?
I think it's kind of similar to ED, but with a little bit of nuance. So premature ejaculation itself is not related to low sex drive. But just like men with ED can feel avoidant and embarrassed and worried about sexual activity, it's the same thing for men with PE. But what's a little more complicated is that one of the classes of medicines that's really helpful in managing PE are SSRIs. Those are the antidepressant and anti-anxiety medications that doctors like me have repurposed for the treatment of PE. Those medicines sometimes actually have a side effect of a lower sex drive. So you gotta be careful. It's like a really good example of why you gotta be dealing with a healthcare professional when you're trying to manage these types of problems.
Sure, so if y'all watching this at home, don't just take my word for it, even though I'm probably the smartest person ever. Go to an actual professional, like somebody like Dr. Pete that can help you walk through step by step and find the solutions that you're looking for.
Yeah, that's right.
Okay, so Dr. Pete, what about intimacy?
Yeah, that's a good question, right? Because this all gets pretty complicated. There's like some brain stuff happening, there's some hormone stuff happening, there's some penis stuff happening, and that's all happening in the context of a relationship usually, right? So, and when relationships go bad or people are just kind of like not connected from an intimacy sexual standpoint, that very obviously has an impact on the desire to be together, right? And then that can snowball into more relationship issues, more disconnects, and really chronic avoidance that can become like a major relationship stressor. So if you're trying to distinguish between like a relationship intimacy partner specific issue and like a more global lack of libido, which really can prompt like a medical evaluation, I think it's like thinking about, okay, if I'm walking around, am I getting that whatever you did earlier. Yeah.
Yeah.
Yeah, it doesn't
Yeah.
feel right when I do it. I'm not
It
gonna
feels
lie to
right
you.
for me. I'm not gonna lie to you. Definitely gotta create intimacy. So doctor's orders, go on a date. Take your significant other out on a date, maybe watch a movie, let them pick the movie. And actually, I do have a special treat for y'all. Dr. Pete has agreed to tell his top 5 most intimate things that he does with his wife to keep his life in order. Pete, you wanna go take those? We're gonna do that off camera, but thank you so much, Dr. Pete, for all your amazing wisdom and walking us through all this talk.
Yeah, it's my pleasure.
Appreciate it, Dr. Pete. And if you guys want Dr. Pete's wisdom, come back, like, subscribe, follow for more content just like this. Thank you.